So today I'm going to show you guys how to take off and change your post-operative dressing from a knee surgery, okay? Now depending on the surgery you had, you may have a brace on here. So to take the dressing off, you have to take the brace off first, and if you're not sure how to do that, you can check the other video at the instructions for how to take the brace off. So all of my patients will have a knee strap and a wearable dressing underneath, which I'll show you. Some patients will also have a big white stocking on underneath this part. So keep that in mind, and I'll tell you at which point you have to take that stocking off, if that's the case. So the first thing you do, you have an A-strap on, you just start unrolling the A-strap. And when you take the A-strap off, the next layer that you're going to see every time is this white kind of soft cast pad. So you take the A-strap, you're going to throw that out. I'm just going to put that over here for now. And the soft cast padding, it's under this layer that you're going to have a white stocking, if you have one. And the white stocking is going to be holding your the gauze and all the padding. Okay, so if you take this white roll off, nothing's going to fall off if you have a white stocking on. If you don't have a white stocking on, it's going to be like this, where I pull off this this white roll, and you'll find that right underneath there, you'll start seeing gauze, and you could just let this all fall right off. So here's the gauze and the ABD pads, like we call them, right here. And once you take this part off, this will all fall off, and this may be covered with a little bit of oozing and bleeding. Now underneath this, you'll see white band-aids on your knee, and the ones that I have on David here are just if you had a regular standard knee arthroscopy without, an ACL or anything like that. You may have an incision here or a small incision here, depending on the surgery you had, where you're going to round the kneecap. And they're all going to have white band-aids on them. So what you should do afterwards, get rid of the big white pads. You want to buy some waterproof band-aids at the pharmacy. And some of those waterproof band-aids are called tegaderms. They're big, essentially plastic coverings. And you want to also buy some gauze, some fresh gauze. What you're going to do is, you're going to just take some of that fresh gauze and one of the clear waterproof dressings, and some of them have the gauze already built in, so if that's the case, you don't have to worry about that. You take the plastic off, you're going to put the gauze pad on, the area where you want to cover, and you're just going to put that and cover that whole area with your dressing. Okay? And that way, this area is now waterproof, so I'm going to do that one more with the other side. And usually you only need one of these 4x4 gauze pads, as the oozing usually stops a couple days after surgery, and you want to take these dressings off about 2 days after surgery. So again, I put this over that area where the white band-aids are, and I cover that as well. And now you'll notice that all the plastic is covering the white band-aids. The key is to make sure that you have the white plastic fully covering the white band-aids. Then you know that it's completely waterproof and you can shower with this dressing. So that's the most important thing. Once you have this dressing on, you can leave this on until you see maybe your first post-operative visit, about a week, sometimes 2 weeks after, unless they start saturating with a little bit of blood, in which case you can take these off and put some new dressings on. Sometimes when you take these off, the white band-aids might come with them, and if that happens, don't worry about that, just replace them